Sorry, shouldn't be looking at the computer, obviously. Okay, so thanks everybody for the presentations, and we are now ready for Q&A. And before, or perhaps as you're thinking about your question, you can pick out your orange evaluation sheet and start working on that, because we really do value your feedback. And if you found this session informative and want to hear more in other overview sessions, this is a great way to let us know the topics that you're specifically interested in. So there are 2 mics up in front. If you have a question, please come up and state your name and your organization. You may begin.
Hi, Terry Boughton. Gretchen, I was wondering if you could mention what the cash benefit in class can be spent on. What an example of the supports that you were referring to.
Sure, I'd be happy to. So the cash benefit that would be allowable under the class plan in the event that someone had met the benefit eligibility criteria, where that they had functional limitation of having difficulty bathing, dressing, et cetera. However, that's going to be defined in the regulation. Right now, it is not specified in a detailed way about how people could use that cash benefit, but the concept underlying the provision in the law is that people could utilize it in the way in which would help them be able to maintain in their homes and communities. And one of the things that the SCAN Foundation has recently put forth were a number of technical assistance briefs on class that outline ways in which people can think about implementing provisions of the law. And this is one of those very specific questions that is laid out about what are the kinds of supports and services, whether it's personal care by someone from the paid workforce or a family member or a neighbor, whether it is care management services, somebody to help figure out all of the details between the health care and all the doctors and the prescriptions and manage a person's total care, whether it's technology, somebody having a pill box that talks to them, or some other kind of medical assistance device that's technologically oriented, whether it's a transportation service, whether it is a ramp installed in their home that will help them be able to not have to leave their home environment because there's stairs to get in the front door. There's a number of different kind of domains and supports and services that theoretically could be used under the class plan. Regulations will spell that out more in a detailed way, but there are a number of ways to think about a range of supports and services that people could use that really help them be able to live independently in their home. And so for more information, I'd be happy to guide anyone to that class technical assistance brief that lays out all of the kinds of options. And you think about the kinds of things that we all need to be able to maintain our independence. Those things would theoretically be available under that cash benefit.
So we can only conclude that we've provided you with all the information that you've ever wanted to know about health reform. No, okay.
I wouldn't go that far.
Tell us your name.
Carl Close from the Independent Institute. And I'm wondering what the effect of the Affordable Care Act will be on the rate of entry of new insurers into the private insurance market.
Great question. Impossible to tell, I think. California's insurer market actually has been very stable over the, sadly, decades. I've been watching it carefully. There has been some consolidation among existing insurers, but there have not been a lot of new entrants in the past, and there has not been a lot of departure either. I think that there is some possibility that, depending on how the exchange interprets its role and forthcoming rules from both the federal and state level, that the exchange could either make the individual market more attractive or less attractive for insurers' participation. But my personal analysis is there's not enough to know yet, and at the moment I would actually anticipate that it would tend to stabilize things even more than they are today, that we wouldn't see a lot of churn, but there is some risk of that.
Cynthia Robinson, Department of Healthcare Services. So Janet, is there a way to find out what percentage of the practice for the National Health Service Corps are Medi-Cal beneficiaries?
So Cynthia's question is, do we know the percentage of the persons served by National Health Service Corps participants who are on Medi-Cal? I don't have that number off the top of my head. There probably is a way to get that from the Region 9 Health Resources and Services Office, but my guess would be a very large percentage because most of the National Health Service Corps participants are in community health centers, rural health clinics, some public hospitals, some prisons, and in those settings, the majority of the patients served are Medi-Cal or uninsured.
Hi, my name is Erin Flannery, and I work with the California State Assembly. I have a question probably for Karen, which is the ACA seems to have a lot of very specific requirements, 80%, 85%, 15%, 65%. And it seems like this kind of program requires a lot of oversight. So who is going to be providing the oversight for some of these programs? I'm assuming that some of these bodies are already in place to provide some oversight, but a lot of these programs are very new. So do you have any thoughts on that?
I will certainly ask the other folks on the panel to respond, but I understand that for the Health Benefit Exchange Board that there will, there's 4 out of the 5 positions have been filled. They're having their first meeting next week as a public meeting that anybody can go to, but I defer to other folks on the panel.
I'll just say on the insurance issues, there will be new activities and new people in roles at both the federal government and at the state government, I think. But most of those will be housed within the structures that have related responsibilities today. One of the questions that I think is really quite interesting is whether with this new regulatory layer at the federal level and with some more uniformity in some ways at the federal level than is in place today, what the implications are for the state regulatory bodies and if there are ways to revision those roles and maybe streamline them a little bit so that instead of having lots of people looking at a different piece, there's a little bit more coherence to the way that is overseen. I think there are movements in that direction, but we have years to continue that conversation.
Right, thank you.
Thanks. Other questions?
Oh, one more answer.
Oh, sorry, Gretchen.
I was just going to respond that in terms of many of the long-term services and supports provisions, that the way in which to think about those is that there were delivery system changes, and so many of the existing regulatory bodies that exist at the state level will maintain their role. And that one, I think, especially in relation to Marion's comment, that what the impact is at the federal level is to streamline some of those processes for the Medi-Cal waivers so that it is not as cumbersome as I think it's been for states, having multiple waivers, multiple populations, multiple reporting requirements, and kind of more silos at the federal level. The idea is to streamline those and to not have as many of those silos so that it can actually be a bit easier on the state regulatory process of the way in which the services are delivered. And CLAS certainly has its own advisory body the same way that the Social Security Administration over Social Security and in Medicare has an advisory body about that plan as well.
Okay, next question.
Hi. I'm Roberta Battle with the Older Women's League, or OWL. And my question is for, I think, Gretchen. Is the concept or the provisions of the CLAS Act intended for people under 65?
In terms of, yes, I mean, I would say that CLAS particularly is about working individuals today purchasing into a plan that they could use at any point in time after the vesting period in which they incur functional limitations. And so it doesn't really have an age barrier except that one does need to be a working adult in order to pay into the program. Students have a provision where they can pay less to buy into that program with the idea of getting younger people enrolled. But ultimately, CLAS is about community living. It's not bound particularly by age. It's more about function.
Okay, but it is limited mainly because we're talking working. So even though we're working longer, it's still not focused really on seniors so much.
It's really focused on the seniors of tomorrow, and there are many older people today who are working and would meet the working age, working income level in order to be qualified as working and be able to buy in. One element of CLAS is that for individuals, and I hope I'm going to get the number right, I believe it's for individuals who are 60 and above, that they would only need to be working 3 of those 5 vesting years. And so there is a kind of a provision in that, and that will be more clarified, obviously, in the regulation, that individuals who will be kind of 65 soon, but necessarily aren't there yet, would still be able to have access to paying into class. Thank you. You're welcome.
Hi, Danielle Mollet with the California Family Resource Association. Family resource centers do a lot of community prevention efforts, so we're really interested in the prevention piece. And specifically, there is studies that have been done by Kaiser, the adverse childhood experience studies, that link a lot of adverse childhood traumatic experiences to chronic illness as an adult, specifically child abuse, sexual assault, domestic violence in the home, parental incarceration. So I was wondering if there's any discussion of these types of community prevention efforts, or if it's really just a lot of the healthy food, healthy living.
That's a really good question. You know, the Community Transformation Grants program it builds off Communities Putting Prevention to Work, which is a program that was funded through the stimulus. And while it does have an emphasis, so we don't really know what Community Transformation Grants are going to look like yet. Soon. We were told this week, but we will know soon. If we're going to base it off what CPPW looked like, then it is totally up to communities to shape their programs. And while there is a focus on healthy eating, active living, tobacco control, there have been a couple communities across the country that have focused on violence prevention and on mental health issues. And because comprehensive type of community prevention strategies do cut across issue areas, I do think that there is the opportunity to touch on those issues. It really depends on the specific initiative. That's sort of the beauty of the program too.
And what's the time frame for those again?
The release of the FOAs for CTGs, we thought this week.
Acronyms? Thank you.
Funding announcements for the community transformation grants, we were told 2 days ago.
Okay, great. Next.
Hi, my name is Tracy Corda, and I work with California Children's Services Program. My question is for Marion. I was really intrigued to hear that Medi-Cal Healthy Families and the Exchange, the coordinating of purchasing idea, maybe making it more coordinated. Tell me, if you could, more about that and who would be looking at that specifically, what body?
Yeah, I mean, I think that the exchange, which as Karen mentioned, the board is just going to start meeting, will have some very early questions about how it wants to position itself and what its priorities are. But the minutes come even during questions.
How can this be? How can this be?
So I think the exchange might be one place where you could look for that leadership, but not necessarily the only place. You know, that number about the current size of Medi-Cal and the level at which it is anticipated to grow means to me that there is a huge opportunity for Medi-Cal to look at itself again and say, how do we become the Medi-Cal of the future? How do we work with private partners, with Medi-Cal managed care plans, with consumers and our population to become the program we aspire to be? And one way, I think, where it might have more leverage and more impact would be to think about the way that it purchases goods and the accountability that it holds people to when it does so.
Okay, great. Well, we've gotten our 2-minute warning for questions, so if anybody has a burning question, race to the microphone right now. Terry, do you want to?
Here he comes.
Oh, okay.
One of my concerns about this talk has been the fact that the individual mandate for insurance is a central part of the ACA. And there is a chance that the Supreme Court would declare that part of the bill unconstitutional. How concerned are you all about that?
So are you asking, are we living in fantasy land? Is that what is that sort of to rephrase the question? Yeah, I think that is a fair question, and I think that it is perhaps the most specific and central way in which the direction we think we're headed might change based on the developments of the future. In that case, legal challenges, but you know, we've heard about funding challenges or limitations. We've heard about all kinds of ways where the current vision of what's going to happen in 2014 could easily be tweaked. The individual mandate is certainly important, and it's I think, quite fair to say that if you eliminated it, you would have many cascading effects about health insurance participation, about many other things. But at the same time, the mandate is already, it has some, what do I want to say, some seepage, some ways to get around it. There are already some exemptions by eligibility there. And there are alternatives that could still dramatically increase the incentives or penalties that people would have to get into the system. That even if you didn't have a mandate, you could substitute some other policy approaches theoretically. Now, whether our policymakers would have the opportunity and the will to do that in a organized, systematic way, that would be a fruitful and lengthy discussion. But to me, the combination of my assessment of how likely that is, plus the consequences of completely overturning and undoing all of the progress together, nothing there makes me think I should give up my day job and go do something else. I think that there's a lot that is very likely happening, and that it's critical to plan now for the likely future, even if we don't know exactly what the future will look like.
Agreed.
Okay. Well, and that's a great topic to write in your other specify box on the topic list for a future session. So please join me in thanking the panel. Thank you all for coming today.
Thank you all. Thank you.
And again, please fill out your orange evaluation sheets and help yourself to the, there are some cookies left and lots of fruit and beverages. So please enjoy those.
Well, thank you all very much.
Yeah.
Thank you.
Kind of a challenging format, but